Our lecture today about the practical anatomy of the basal ganglia. Now you are seeing a horizontal section through the brain at the level of the lateral fissure. You see here, this is the lateral fissure and the floor of it, which is the insular cortex here. So the horizontal section pass from here and we perform the section of the brain. Now, what about the basal ganglia? The basal ganglia constitute the following nucleus: the caudate nucleus, the lentiform nucleus. In this section, you are seeing now, this is the anterior horn of the lateral ventricle. These are the anterior horn of the lateral ventricles, as we mentioned in the previous practical lecture. This is the head of the caudate nucleus, which bulges medially to the anterior horn of the lateral ventricle. You see about that? This is the head of the caudate nucleus. Below it, this is the thalamus. This is the thalamus here. This is the putamen part of the lentiform nucleus. Putamen part of the lentiform nucleus. This is the globose part of the lentiform nucleus. The nucleus consists of two parts: the globose and the putamen part of the lentiform nucleus. Globus pallidus. As you see here, between the caudate nucleus, the head of the caudate nucleus and the thalamus, and the putamen and lentiform nucleus, we have this white band of fiber. We name it the internal capsule. This is the internal capsule. The internal capsule constitutes the fiber that connect the higher center in the brain with the lower center of the central nervous system. And it consists of many parts from the anatomical point of view. This is the anterior horn, as you see. This is the anterior horn of the, the anterior limb of the internal capsule that separates between the caudate, head of caudate nucleus and the putamen. But if you focus here, you'll see there is a band of connection between the head of caudate nucleus and the putamen. So these two parts are interconnected with each other above the anterior limb of the internal capsule. So collectively, these parts we name it as the corpus striatum. Corpus striatum. Collectively, we form the corpus striatum. This is the genome of the internal capsule, the mid part that connects the anterior limb to the posterior limb of the internal capsule. This is the posterior limb of the internal capsule. This is the retrolenticular part of the internal capsule. And we have what we call the sublenticular part below this nucleus of the internal capsule. So the internal capsule consists of 5 parts from anatomical point of view. When we go laterally more, we see this white band of fiber. We name it the external capsule. The internal capsule embedded within this nucleus. And this band of white fiber, we call it the external capsule. And if you focus here, you'll see this band of gray color. We name it the claustrum. So collectively, this structure, we name it the basal ganglia, except the thalamus. The claustrum, the putamen, the globus pallidus, and the head of caudate nucleus. These collectively, we name it the basal ganglia. And we mentioned in the previous practical lecture, these are receiving blood supply from the medial arteries of the circle of Willis and functioning as the control system of CNS, of the cerebral cortex. two important diseases للاطلاع فقط للمعلومات راح تشوفون انه two important diseases تصير هنا باركنسون والهاتكتين ديزيز كلش كمان بالعراق فبس حبيت اشوفكم فيديو لمدة دقيقة على مود هذه these diseases. Now you are seeing this patient. This patient are suffering from Parkinson's disease. As you see here, this patient suffers from Parkinson's disease result from degeneration of neuron within the caudate nucleus. As you see, he has difficulties in drinking water and he has a tremor as you see, and will respond to this electrical signal and the tremor will slightly relieve. As you see in this video, this patient suffers from Parkinson's disease, which is one of the diseases of the caudate nucleus. One of the diseases of the caudate nucleus result from degeneration of the neuron and decreased dopamine level. This is the intention tremor when we have malfunctioning caudate nucleus. So this video show when we have caudate nucleus problem. The other video we will see this patient suffer from Huntington disease and Korea, suffer from irregular movement. She cannot control the movement of her body. As you see, this patient sits normally on the chair, but this abnormal movement, this poor patient suffer from this and will fall off from the chair. Even she is conscious and connected to and respond to her family, but she suffers from this abnormal movement. Huntington disease results from degeneration also of a neuron within the caudate nucleus. The caudate nucleus is C in shape, also contain a body and contain a tail and amygdala part. Pause. Okay, we continue our video. We mentioned that there is a head and a body of the tail of the caudate nucleus. You see here, this section, this is the thalamus, and this is the groove between the caudate nucleus and the thalamus, contain the thalamostriate vein. This is very important. At this part, it represents the floor of the lateral ventricle we mentioned. This is the caudate nucleus. It is C shape, as you see here, contain a head and a body and a tail, and terminally as the amygdala nucleus. So this section represents the caudate nucleus. You see the C shape of it. And this is the thalamus, and the groove in between the caudate and the thalamus contain the thalamostriatal vein, which is one of the origin of the internal cerebral vein. Thank you.